Hi, it's Dr. Rick. I'm coming to you with the topic of back pain. Kind of a pain in the neck, or a pain in the back. So, back pain can really be from three things, and it's usually just three things. Now, I can throw in an extra one, but for the purposes of our talk, we'll concentrate on the typical three. The number one reason that everybody comes to the doctor's office is muscle spasm. There's a couple different reasons for back pain, and muscle spasm is the number one, the most common. This is a model of the back. You're looking at somebody's back. The tailbone is down here. The back of the skull is up here. You have cervical spine, 7. Thoracic spine, 12. Lumbar spine, 5. And then 5 coccygeals and 5 sacral, and then 4 or 5 coccygeals. So all the bones are for support. You would think that if you have bones for support, you wouldn't have flexibility, but God gave us these little discs, jelly discs between each of these vertebral bodies to allow for some degree of movement. And if you total up all the movement with all these discs, and there's one between each, you'll have some pretty decent flexibility, as seen in some of my yoga classes. Some of the women especially that are really great and avid practitioners of yoga will get into some unusual positions, and that's great. But you always have to balance out high flexibility with musculature, and you have to balance out excessive muscle with flexibility. You can't have too much of an extreme of one, or else you wind up with problems. So sticking to the talk on the vertebral column, I like to talk or use an anecdote of soup cans being stacked on top of each other, each one being separated by a jelly donut. These vertebral bodies are strong. They also are supposed to be housing and protecting the spinal cord right down the center. So the jelly donut, though, is not so strong. And the older you get, the less jelly you have. Less jelly you have, the more the soup cans will kind of crush the jelly donut, since there's no jelly. If that happens, you would think, not a big deal, but every time you crush the disc, you also will crush, that's the disc by the way, you'll also crush the nerve that comes out at the disc level. So that's why you have to stay healthy, you have to stay supple, you have to stay hydrated, and you have to eat properly. People who eat with a pro-inflammatory diet will disintegrate everything. You'll turn supple, flexible tissue into cardboard. And not only will it be stiff and cardboard-like, it'll also collapse. The jelly donut, if the jelly doesn't stay in the middle, it protrudes, and there is no space in this compartment, no space for even a little bit of a protrusion to occur. I'm going to show you this disc. There's a fake bulging disc here. You'll see that the lumbar spines are all separated by jelly donuts. Hopefully this is coming into focus. And this one is a disc that's protruding. Looks like a tongue. And you'll notice that it protrudes in an area where there's no resistance. And this root, where the spinal cord lets go of a root, this is where the disc will push into. And that's where you get a pinched nerve. The lumbar spine has 5 segments, and each lumbar root of the 5 comes down and forms a plexus down here, and it's essentially 5 wrapped into one, so it's convenient, easy to grow and protect. And it comes down the backside through the glute muscle next to the piriformis into the leg. That's called a sciatic nerve. And that's why people get sciatica, is when the disc protrudes, the nerve gets pinched, and you'll have shooting pain down the leg. And it kind of depends. Doctors who are really good, chiropractors who are really good, even exercise physiologists can tell you, depending on which area of your leg, foot, ankle, or thigh is being irritated, shot down, or numb and tingly, we can tell you which nerve is being pinched on the most. Some people have multiple segments, but regardless, the objective is to have the body extend enough so the disc will get sucked back in. unless it's taken some chips of bone and deposited them into the nerve. Then you need surgery. The surgeons nowadays, and I've got some great friends who are surgeons, can do microdiscectomies, can do small incision surgeries, but the idea is to stay healthy and prevent that. So the folks who are obese, carrying extra weight, they won't sit like this. That tummy is going to be sticking out like a pregnant mom, and you're going to be pinching that disc out. So when the backbone pinches this way, because the belly's so round and protruding, these nerves back here gets pinched, the discs are forced to go out the back. So that's why it's important to maintain a decent weight. It's also important to maintain a little bit of flexibility and exercise. But if you exercise, you should maintain weight. So when you have a disc that's protruding and you have shooting pain, well, it's difficult, but usually you'll need pain control in the form of an anti-inflammatory, because there's a lot of jelly. The jelly in here has arachidonic acid. It irritates the nerve. So if you take enough of a pill to block arachidonic acid, which is a product of inflammation in the blood, you'll block inflammation and pain. That's usually an anti-inflammatory. Advil, Aleve, Motrin, ibuprofen, naproxen, aspirin, they're all anti-inflammatories. I have better ones that I use, specifically Relifen, Lodine, Meloxicam. Those are the old tried and true ones that don't cause as much irritation to the stomach. And then there's the Celebrexes, the Bextras, but Bextras are off the market now, and another one, and I forget the name of it. But that family I would be very careful about. Supposedly Celebrex can be used in people who have ulcer disease. I wouldn't take a chance. You might have a heart attack or kidney failure, but if you want to take a chance, that's fine. There are other things to use, and as I mentioned in other videos, there are anti-inflammatory herbs like turmeric. If there's a joint involved, there's a joint that usually this transverse process of one vertebral body will touch the transverse process of the vertebral body below it and give it stability, like a tripod. So there's more stability in certain positions. So bone-to-bone irritation, you might need glucosamine sulfate. If it's just pure muscle spasm, like we talked about as being the #1 reason for visits to the emergency room, magnesium, white willow bark. I like helichrysum. I'll put a link to the topical talk that I did, and I'll put another link to magnesium. I just love the way magnesium works to relax muscle. So if it's that bad though, and you need prescription medicines, then we have, like I mentioned, anti-inflammatories. We also have the most potent anti-inflammatory known to man, which is steroids. Sometimes people who look like they've pinched a nerve, act like they've pinched a nerve, or have pinched a nerve. So you want to go and get them reversed quickly. And that's where the power of Western medicine is great. Prednisone is a steroid. Steroids do cause weight gain. If used for a long amount of time, they can. I've had a couple of sensitive people who just in 5 days have gained weight, but the majority of people, the biggest side effect is having insomnia and not being able to fall asleep. That's why I usually suggest taking it in the morning. All the studies that I've read since 1995 have said you do not have to taper off anything 5 days or less of steroids, but you have people giving these Medrol dose packs, which I guess are easy to administer and no-brainers, because the blister pack has on the first day 6, on the next day 5, and then 4 and 3. It's really easy to understand. But you don't have to taper a steroid if you're doing it less than 5 days. So anyway, I think it's weak. I'd rather just do straight dosing every morning for 5 mornings straight. You can't have steroids if you're diabetic because it makes all the sugars go up. So the beauty of steroids is that it will take away inflammation quickly as long as you rest. If you take all the medicines we give, muscle relaxers included, narcotics included, and you don't stop working, what do you expect? You're going to be in pain and you're going to have to see my surgery friends. I think acupuncture works, but you have to be patient. I had a guy back in the 90s, or back in the early millennium, he wanted acupuncture to take care of his bulging disc or his radiculopathy, his sciatic nerve, but he insisted he wasn't going to stop working because he had to make money. I stopped it. I told him that I can help you get better, but if you're not going to stop the offending activity, you're wasting my time and your time, so you can go somewhere else. I hate to say it, but I did it that way. Talking about muscle relaxers, if the muscle is spasmed up enough on one side, it'll shorten the side, it'll make the patient kind of walk funny. That too can spasm and pinch off a nerve, so you want to relax muscle. That's why muscle relaxers are useful, but they have heavy side effects. Dry mouth, dizziness, can't focus, very sleepy. Some muscle relaxers are very strong, like Flexeril, cyclobenzaprine. Other muscle relaxers are not so bad. I like Xanaflex, Scalaxin. Those are pretty decent, but for the most sensitive patients, you'll feel the effects. Anyway, they do relax. The old way is to use Valium, but there's too many side effects of Valium, and the addictive properties are tough. Finally, when people are in pain and the muscles are spasming or the disc is hitting the nerve, usually you'll walk around stiff, and when you walk around like that and you're just in pain all the time, you will have increased inflammatory markers floating all around the bloodstream. It will not help you heal up. So we like to at least use some pain control medicine to get people to at least sleep. Sleeping is important. If you're tossing and turning and not sleeping, believe me, the brain doesn't get rest. It's been suffering all day. You'll be irritable. You'll not do a good job. You'll fall down. You miss a step. You'll spill coffee. You'll miscalculate. It's not worth it. So for above the brain, above the neck, we give Tylenol with codeine, Vicodin, Tramadol, all those real potent injections that we do in the emergency room. They do nothing. They do nothing for the inflammation caused here. They only help the brain. So if you need pain control because you're suffering, I can knock out your sense of pain and you'll walk around. You'll still have a disc that's pinched. You'll still have a muscle that's spasmed, but you won't be thinking about it too much. So this is the inherent problem. People get the pain medicines, the Norcos, the hydrocodons, the Tylenol with codeines, the Percocets, and they feel so good with it that they ignore this. And then when they stop the medicine, pain comes back. Oh, I must need more medicine. So they keep on with this vicious cycle. I need pain medicine to get through my day. Oh, I happen to be a construction worker. No. I happen to lift pianos. No. So the other thing inherently problematic with narcotics is they're very addictive. So even if the pain does go away, or the reason does go away, the structural problem, the brain's going to say, I like the way I felt, I want some more. And then you'll be hunting for it without even knowing it. So the three medicines I just mentioned, the anti-inflammatories, the muscle relaxers, and then the narcotics are the triplet of medicines to give in an emergency room. That will make people get back to functioning fast. I think physical therapy is important, especially if this is a recurrent problem. If you help fix the dynamics of movement, help stretch the back, chiropractic is great. You have to go to the right chiropractor though. Chiropractic, especially the mixers, there's two types of chiropractors, mixers and straights. The straights are the younger guys who just do manipulation and they do great jobs. The mixers will actually know the levels of which organ gets affected by which level, and they'll try to get the person not only feeling better but also healthier with the manipulation. So either way, chiropractors are great. Just have to know which ones are good, which ones you should stay away from, just like doctors. So I like chiropractic. I get chiropractic adjustments myself, and I think it's important to alleviate. I think actually if you go to the right chiropractor, they'll get you better faster than any of my prescription medicines. But I'll put my acupuncture needles up against any chiropractor and I'll probably get you better results. And thus, the acupuncture. I think acupuncture is very useful for back pain. I like using acupuncture needles in areas of the muscle that are spasmed, and I like using electricity so it really relaxes the muscle. There's also, with acupuncture, not only do you relax muscle, you also get the energy flowing that's kind of blocked up with people who have back pain, especially kidney meridias or bladder meridias. You can see my video on alternative medicine and kind of get a feel for how my father went through acupuncture. But the idea is not only to relax muscle, but to also get this sense of well-being. Anybody that's been through electric acupuncture for 20 minutes to 30 minutes will usually feel a sense of wellness. That's because it's an endorphin rush and a serotonin release with acupuncture as well. So why not? Anyway, That happens with chiropractic, if with the right chiropractor. That happens with massage therapy. All of these are important when it comes to healing the muscle or the back pain. The last that we'll talk about is the third reason for back pain. First being muscle, second being disc, third and pinched nerve, third being a fracture. The likelihood of a fracture is low, but it can happen in the elderly with osteoporosis. It can happen with people who have poor B12 absorption, poor protein absorption. Those are people that take Protonix, Prilosec, Prevacid, a long-term, lansoprazole. They all are using medicines that are probably blocking absorption of vital nutrient from the gut. It might help with reflux and acid, but you're also blocking absorption. So anyway, the plain old osteoporotic sufferers will also be high risk for breaking backbone. I have people who are osteoporotic from chronic steroid use, the asthmatics mostly, and COPDers. They sneeze and they'll crush one of these vertebral bodies. If you crush one of these things, it's a tough call. Sometimes, most of the time, it'll be diagnosed by x-rays, CT scans, bone scans, but it's really just mostly bed rest, sometimes something called a Boston back brace if there's a breakup here, spondylolysis or spondylolisthesis. Usually Boston back braces are used in adolescents that are in gymnastics or break backbones here. But that would be the last thing. Sometimes the very young can break, sometimes the very old will break, sometimes people with tumors will break. Multiple myeloma patients, osteoporotic patients. So the likelihood of a fracture is low unless the velocity is very high impact, like a car accident, a fall from a construction site. Those things can break bone, but that's the lowest likelihood. So hopefully this helps with regards to what causes back pain. As far as how we alleviate back pain medicinally, whether it's herbs or prescriptions, I've discussed that. How to alleviate back pain with regards to hands-on, again, chiropractic, physical therapy, acupuncture, massage therapy, and plain old rest. If you rob yourself of sleep and rest, you're going to postpone the healing process. Most of all, if you do have any problems with recurrent back pain, sometimes you might want to have a steroid shot into the area. Usually, it's like an epidural. In an epidural, when mom gives birth, the doctor will go between these spinous processes, stick a needle into the area on top of the nerve, not in the nerve, on top of it, and they'll dump numbing medicine there. And that numbing will kind of numb all the roots of the sciatic nerve, and it's called a saddle block. But when you have inflammation, they dump steroids in this area to bathe the nerve that's getting pinched on. If the nerve is getting pinched by a disc, then while you're getting rid of the disc on your own, the steroids will protect the nerve and decrease the pain, decrease the inflammation. The unfortunate problem is some people just get the shot and they keep on going with their normal activity. So again, we go back to you have to listen to your body and you have to treat it properly. You have to give your body the proper building blocks, and when it's necessary you have to go for the prescriptions or the surgeries. If it is not necessary, and usually isn't, because as I mentioned to you, the majority of people that come in with back pain are muscular dysfunction, you can get by with a lot of other alternative and complementary means to getting better. It always comes back to preventing the next one from occurring. Just because you have surgery to fuse one of these things doesn't mean you're done. People are really fooled when they say, I've had a fusion. What the surgeons will do is they'll, instead of having a disc that will bulge out, they'll just fuse this, and there's not going to be a disc anymore. But guess what happens when you fuse one segment? When you try to move, the segment above and the segment below have to do more work. Remember the kinetic chain we talked about? So you will cause problems above and below the area of fusion. So fusion by itself is not an answer. And if you decrease your activity because of pain of the fusion, you're asking for another problem to occur. So flexibility, most important. Strength, important. Listening to your body is is probably the thing that I have to elicit from you, or at least tell you, guide you as far as what to do and what to listen for. And if you can't heed my suggestions, I'll send you to my friends.